While Black Americans make up 13% of the general U.S. population, they represent 34% of the correctional population. Black men have a 1 in 4 chance of going to prison in their lifetime. A Black person is 5 times more likely to be stopped without just cause than a white person. 35% of the individuals executed under the death penalty within the last 40 years have been Nationwide, African American children represent 32% of children who are arrested and 52% of children whose cases are judicially waived to criminal court. Today, we learn about the lasting impacts of incarceration on health. First, we'll take a historical lens to understand where these racial disparities originated. Mass incarceration began under Ronald Reagan's presidency in the 70s as a response to the war on drugs. Black Americans were targeted at far higher rates than white Americans through targeted policing and minimum sentencing laws. Crack cocaine, which was more prevalent in communities of color, was more harshly criminalized than powder cocaine, which was more prevalent in white communities. The legacies and impacts of these policies are still seen today. According to a study done by Hamilton and the Brookings Institute, while white and Black Americans use and sell drugs at about the same rate, Black Americans are 6.5 times more likely to be incarcerated for drug-related crimes. These factors all contribute to what scholars have named the prison industrial complex, defined by the Critical Resistance Organization as, quote, the overlapping interests of government and industry that use surveillance, policing, and imprisonment as solutions to economic, social, and political problems. The prison industrial complex is a public health issue, a manifestation of how structural racism in the United States produces disparate health outcomes. Prisons and jails themselves are not conducive to good health. Incarcerated individuals have far higher risks of being infected with many diseases while being confined in a space with little control over their own migration patterns. One of the more studied infectious diseases among the incarcerated is HIV. The HIV infection rate in correctional facilities is approximately 3 times higher than the general population, according to a Current Opinion in Infectious Diseases article, highlighting the epidemic of mass incarceration. The COVID-19 pandemic is another immediate example of the physical health risks of incarceration. According to the Equal Justice Initiative, incarcerated individuals are infected with COVID at 5 times the rate of the general population, along with far higher death rates. The statistics surrounding these two diseases barely scratches the surface of the impacts of incarceration on health. Social isolation and disconnection from family support can cause major psychological distress. In addition, feeling a lack of efficacy and autonomy can further deteriorate mental health. Researchers have recently just begun studying the mental, physical, and social detriments accompanying incarceration, and the effects on health are not confined to prison walls. For the rest of this episode, I'd like to focus on the impact of incarceration outside of correctional facilities. For the formerly incarcerated, the label of former convict permeates their experiences. Researchers from the Puget Sound Veteran Affairs Medical Center have found that in the 2-week period following release, former prisoners are at a 12-fold increased risk of death. This short but critical period highlights the need for immediate access to medical care and preventative services during community reentry. During this time, the formerly incarcerated are also tasked with finding housing and employment, reconnecting with family, and adjusting back to daily life they have not experienced since before their incarceration. Researchers have found that time and time again, wealth is the largest determinant of health. Individuals with access to economic capital, like high income, and social capital, like having connections with political or social influence, have better health outcomes than those without access. For this reason, it is critical for people who have been extricated from society to have access to such resources to avoid their already increased risk of mortality. For Black Americans, obtaining employment and/or health care with a criminal record can be even more challenging. A study from Harvard University found that white men with a criminal record were more likely than Black men with no criminal record to be called back for an interview or job offer. Discrimination, stigma, and racism at the interpersonal and structural level prevent access to resources that promote good health outcomes and pathways to avoid risk factors. Throughout this episode, I've mentioned many different statistics surrounding the effects of incarceration on health. While these are helpful to understand the impact on a large level, it will never be able to demonstrate the individual experiences of the formerly incarcerated. A 2019 journal article called "It's Hard Out Here If You're a Black Felon: A Critical Examination of Black Male Reentry" tries to dig beneath these statistics to unearth the experience of formerly incarcerated in their daily lives. I'd like to highlight a few parts of the interview to give us more context and center their stories. Content warning for our listeners: the next section contains explicit language. One participant, Randy, when talking about his jacket or criminal record, says, "I tried it, I gave up. But when I can't find a job because of my jacket. I got caught lying on an application before, that's why I don't lie on applications no more. But then they hold that against you still, even though you have been truthful." While talking about the New Jersey Division of Child Protection and Permanency, Randy says, "Like I told you, they're trying to come at me now because of my jacket. They tried to use my jacket against me, telling the children's mom that they don't want us living in the same house. I gotta hide in the closet. I've gotta take my clothes and put them where they can't see it and all that. Man, they gonna question the kids. My oldest daughter is 9 years old. They gonna question a 9 and a 7-year-old. And they tried to question my 3-year-old son." When you find a job, you get a boss that treat you like shit because you've been locked up, and they talk to you fucked up, like you're supposed to take it. When I found another job, they found out I was locked up and I just did 21 and a half years. The first thing the man said out of his mouth was, "Motherfucker, when I tell you to do something, you do it." A father, Andre, says, "You can't get money, you can't afford to have health insurance, and your child support is kicking your ass. I gotta pay medical, dental, all that shit for my kids. The court don't care. You know, they don't care how much you bring home. They're going to tell you that they aren't making any changes and you got to pretty much survive on what you got. I got to survive. I can't take care of my kids without taking care of me." If incarceration is meant to be the punishment for breaking the law, why are there such long-lasting impacts on mental and physical health, adjacent to further punishment? To learn more about efforts to reduce the impacts of mass incarceration and racial disparities in the justice system, I recommend our listeners check out the Marshall Project, the Prison Policy Initiative, and the Equal Justice Initiative. This episode is brought to you by your host and producer, Jacqueline Kaufman, and Dr. Savannah Larimore, Professor of Inequality by Design.